You have the upper portions of your heart and the lower portions. The right heart collects all the blood that is low in oxygen. The blood coming from your head, neck, and shoulders returns to the right heart via this particular blood vessel called the superior vena cava. Don't need to know it, just need to know the idea. All the blood from the veins from the lower portion of the body comes back to the right side of the heart via the inferior vena cava. This is the top portion of the heart are called the atrium, and they're collection devices. They open up, they fill with blood, and they squeeze their blood down into the ventricle right here. The right ventricle is very thin-walled. When it contracts, it doesn't have to pump the blood very far. It goes just to the lungs. Heart and lungs are right next to each other, doesn't need a lot of muscle to do that. So when the right heart beats, the blood goes out to the lungs. Notice that the blood here has 16 to 17% oxygen. That's not 0%. It still has some oxygen in it. So if somebody were to suffer from a sudden cardiac arrest and their heart stopped beating and you were to beat their heart for them with your hands, you're still circulating 16 to 17% oxygen to their brain, to the heart, to the kidneys, and other vital organs. Once the blood goes to the lungs and comes back, you've got a full 21%. Is that better? Well, sure, it's better. Comes to the left side of the heart. The left atrium fills up with blood, squeezes its blood down to the left ventricle. Big, thick wall in this muscle here. Every time this quarter beats is when you get a pulse. All right? These little purple guys here represent the blood vessels that feed the heart itself. The heavier you are on the outside, the more fat there is around the arteries feeding the heart. If a little part like this gets blocked off, this area dies. That's a heart attack. But you can have this area die and all the rest of your heart is beating just fine. Notice that one thing about the heart is it's the only muscle that can generate its own electricity. Only muscle. You could be completely brain dead, but the heart can keep going on. Somewhere in the upper portion of this right atrium, there's a spot, like you got a nose or an eye or whatever, there's a spot called the SA node. It sends an electrical signal 60 to 100 times a minute for the heart to beat. 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 This represents what that should look like. This first round bump is the top portions or the atrium contracting. The big spiky thing is the bottom portions of your heart contracting. And that's it resting, getting ready to do it again. The top part, the bottom part, rest. The top part, the bottom part, rest. But you see these little orange X's. Some place other than the green electrical system that meant to be there gets irritable for whatever reason. Maybe you drink too much soda pop and you get a little jittery, a little nervous. Or some people drink too many coffees or too much Monster drink or something like that. And the heart feels like it's going to skip a beat or has an extra beat. That's because a little extra heartbeat did come in here. Well, if this message is trying to send a message at 100 times a minute, and this guy is trying to send a message at 100 times a minute, the heart gets confused and doesn't know who to listen to. And that's when it goes into this fibrillation. Remember that this is an electrical event. The electricity in the heart is not going through the muscle, so the muscle doesn't know what to do and it just lays there and vibrates. This electricity will get smaller and smaller and smaller as the minutes go on until there is no electricity at all. One other thing I want to note in here, we talked about the heart being two hearts. There is a separation between the hearts. It's called the septum. When you are in your mother's womb, the blood goes straight from one side to the other. When you take your first breath, it should seal that hole off. Maybe someone in this room or somebody that you know was born with a hole in their heart. That was somebody whose heart didn't seal off when they took their first breath. So they're getting blood that's low in oxygen, mixing with blood that's high in oxygen. That makes you very weak and tired. If it's a small hole, it's not a big deal. If it's a big hole, it's a very big deal, and they would need surgery to correct it.